I'm getting a lot of questions about progesterone. Specifically, should I be on progesterone? What are the different guidelines? I've heard different things. So let's talk about it. There are two major categories of use for progesterone. The first is to counteract the effects of estrogen on the level of the uterus. So if you still have your uterus and we give you estrogen, your inner lining, the lining of the uterus on the inside, is going to thicken like it would before you're going to get your period. If you're if you're postmenopausal and you're not getting your periods anymore, we don't want that to happen, because you're not going to have that period, you're not going to have that shedding, and it's not what we want for that lining to continue to thicken. That can be, endometrial hyperplasia, and that can lead to, in some cases, endometrial cancer. So that is obviously not what we want. We give you progesterone to counteract that action on the uterus, to prevent that overthickening of the uterine lining that you might get if we gave you estrogen alone and you still had your uterus. That's something that we never do. If you have your uterus and we're giving you estrogen, we always have to give you progesterone to counteract those effects, right? So that's the baseline. And I think that that's the point where people start to have a little bit of confusion, or there are questions that come in, because if you don't have your uterus, or you have something like a Mirena or something else that is already counteracting those effects on the uterus, you don't have that risk of the hyperplasia, of that thickening lining, then you may wonder, well, do I need progesterone? And you don't need it for those reasons, but the other reasons that we give progesterone is to replace progesterone in the body, the same way that we're replacing estrogen. When estrogen levels drop, when progesterone levels drop, there are a lot of reasons that we may want to replace that hormone for you. Sleep, anxiety, to name only a few of the most, common, most important reasons why you need progesterone in your body. So I hope that clears it up a little bit. You absolutely need it. If you have your uterus, you have no other protection at the level of the uterus, and we're giving you estrogen, you absolutely need progesterone. But that is not the only reason why you may need progesterone. It is very helpful to replace that hormone in the body as it depletes in its own right as well.